Good evening, our students. How do you do? I wish you happy and glad. Precisely before our talking about our lecture today, we must mention and refer to the references and scientific references that we depend on for constructing our lectures, our present lecture for you. This is very important scientific resources that we depend on to formulate, to construct the lecture with full information and shapes that make you furnished well with the subject we talked about. Now, about the lecture of today is beginning. I started with the line flux. You know, our student, there is many important organ in our bodies with its fundamental function, and any malady or disease can cause disorder, dysfunction of its function. So according to the site that we dwelled by trematodal parasite, today we will talk about those who can affect our lungs. So lung flux are caused by parasites called Paragonimus as a genus, and the species is Paragonimus wistermani. That can cause paragangliomatosis as a disease, as an infection or parasitic infection, and with common name for this parasite, which is oriental lung flux. Now, actually, there are more than 30 species of trematode flux of the genus Paragonimus have been reported in the world, which affect animals and humans both. We mean with zoonotic importance or occurrence. Among the more than 10 species reported to affect human, the most common is Paragonimus wistermani, the oriental lung flux. These flux are distributed widely, cosmopolitan in the worldwide, and affect an estimated 10 million people in China alone. So it is a huge number, too much number of people can be affected in one station like China. 10 million individuals can be affected alone in China. Infection can cause Infection can cause severe respiratory or cerebral disease, depending on the intensity, duration, and site where the parasite become lodged. This slide can show you the morphological feature of the adult worm of Paragonimus wistermani. The adult worm, as shown here in this beneath two shapes, is an ovoid in shape, reddish brown in color. This flux parasite size about up 12 micrometer long, and the eggs are ovoid, ellipsoid or ovoid, brownish yellow color, with thick shelled and operculated. Also, there is important notice here you must know and understand, which is a diagnosis. We mean if we want to diagnose it over in fecal or sputum or other practical laboratory method, we can take or we have misdiagnosis. So it may be confused with the ova of the Phyllopotherium latum, other species related to cysticercoid parasite, which have the same criteria and shape and size of the ova for this parasite. Now you know the main lung flag to infect humans, which is important and with medical importance, is Paragonimus. Here in this slide we can see the morphological criteria of the adult worms. Here we can see the morphological, external appearance, outer appearance of the adult worm, equipped with oral and ventral suckers and spines, tegment equipped with spines, and the shape oval, ellipsoid. But other shape in the middle can show you the internal structure that the parasite having or occupied with it. Now the ovary, the testes, chordate uterus, methylene gland, and the shaker of digestive system, and other organelles or tissue systems, can viewed here. Okay. Here this slide can show you the morphological criteria of the egg stage, ovum stage, or ova stages. Now you see the unembryonated egg, the unembryonated egg, not embryonated, that be detected within the sputum sample or fecal sample, and oval shaped with operculated. It is so clear here. Now we came back to its life cycle of this parasite, oriental lung flag or trematode. The eggs are excreted unembryonated in the sputum, or alternately they are swallowed and passed with the stool. So there's two routes to excrete this unembryonated egg: in sputum, spit out in the environment, or maybe swallowed from sputum deep inside in our GI down to be excreted out of the fecal specimens in the environment. Now, in the external environment, the eggs become embryonated. We mean it will be matured or developed. It have full developed miracidium. So the egg become embryonated, and the miracidia hatch and seek for the first intermediate host, which is a snail, and penetrate its soft tissue. Miracidia go through several developmental stages inside the snail, which are sporocyst, radia, and cercaria, with the latter giving rise to many cercaria. So many cercarial stages can be formed within the first intermediate host, the snail, which emerge from the snail. The cercaria invade the second intermediate host, a crustacean such as crab, crayfish, or shrimps, where they insist and become metacercaria as an infective stage found within the second intermediate host. We mean infective stage for human being and other animals like pig. This is the infective stage for the mammalian host. Here the metacercaria is the infective stage for the mammalian host. A human infection with Paragonimus wistermani occurs by eating inadequately cooked or pickled crab or crayfish that harbor the infective stage metacercaria or the parasite. the methylcircaria exist, released from the cyst, exist in the duodenum and penetrate through the intestinal wall into the peritoneal cavity, then through the abdominal wall and diaphragm into the lung to reach the lung, where they become encapsulated and developed into adult worms. Now, the worms can also reach other organs, not just lung, but other organs can be reached from this parasite. Other organs and tissue can be affected, such as the brain and stretched muscles, respectively. However, when this takes place, completion of the life cycle is not achieved. Here is very important point. The life cycle completion cannot be achieved, not ended. Why? You will know. Because the reason why. Because the eggs laid cannot excite the sides, these sides. So if the worm can reach such side and be insisted and can lay egg, the egg cannot house any transmission route, any portal exit to GI or to out to environment. So it stay at its side and maybe calcification will occur and granulomas can be formed. Well, now the time from infection to oviposition, the case of the oviput or discharged, revealing of ova or ovule, is 2 to 3 months. Now, infection may persist for 20 years in human. Wow, it is very, very important. It is a problem. Now, the infection may persist for 20 years in human. This in case if not treated with the recommended drug. Now, animals such as pigs, dogs, and a variety of feline species, we mean feline species, cat families, like cat, lions, can also hard paraparagamous. Here in this slide, the life cycle, the complete life cycle from a human started and headed to the human being is well illustrated and showed too. Now the human can give or secrete an embryonated egg as a diagnostic stage, because the cysts in the duodenum, and then penetrate GI to reach the lung, our lungs. The adult encystic cavities in lungs that can give rise or lay eggs which are excreted in sputum, and alternately eggs are swallowed and pass with the stool or fecal specimens to environment as an unembryonated egg stage that having undeveloped miracidium. So after a short period of time, it will be embryonated once. So it will has in the second number 2, after the diagnostic stage, it will become embryonated egg, which mean have egg with full developed miracidium. Now the miracidium will hatch out from the embryonated egg to what? To seek about the first intermediate host, the snail, and penetrate the snail inside and to undergo and witness several different stages, which are sporocyst, radia, and cercaria. Cercaria can be formed many cercaria can be found within the first intermediate host, but will be discharged out to environment in water, especially in aquatic environment. Now, in aquatic environment, the cercaria stage will invade the crustacean as a second intermediate host and assist into metacercaria as an infective stage for human being and other animals. Now, the human come to ingest inadequately cooked or pickled crustacean containing metacercaria. So the infection will occur. So the life cycle of this parasite started from human being when discharged the unimbedded egg and return back and complete its life cycle through different hosts to reach the human again. Well, now about its clinical symptoms and disease. The patient whom infected by such pathogenic parasite will be symptomized and suffer from various clinical symptoms. As the parasites grow in the lung cyst. Now first, inflammatory reaction and fever occurs. Two clinical symptoms: inflammatory reaction and fever will occur. The cyst ruptures and a cough develops, resulting in an increase in sputum. Well, the sputum is frequently blood tinged and may contain numerous dark brown eggs and carcot-laden crystals, and hemoptysis may occur after paroxysms of coughing. Is very important criteria. Now, other criteria or symptoms, which is dyspnea and bronchitis develop with the time during the time of infection. Bronchiectasis may occur and a pleural effusion is sometimes seen. The disease here is very important point, which is the disease resembles pulmonary tuberculosis that caused by TB, Mycobacterial tuberculosis, as a bacterial pathogen. Here the disease resembles pulmonary tuberculosis, and if it found in other sites like cerebral or brain, other site, it can cause cerebral calcification, may also occur. Now the calcification can occur when be found ectopically, other site other than lung organ. Now extra pulmonary involvement, especially by porogenous, may resemble central nervous system tumors or other infection, including brain abscess or neuropsychosis. Here is very, very important criteria pertaining or related to this infection. By here can show you how can you diagnose this infection in laboratory. Now you know, after case history and dietary and evaluation of the regional epidemic and endemic by this pathogen or other pathogenic, we can use the practical method, which are as follow. The most common, we mean the main, and other method can be found like X-ray, MRI, radiology, other detected method can be used, but the important ones detecting characteristic eggs in the sputum, the first. Second, bronchial washing. Third, aspirated brew fluid. This side can be passed from the parasite when it's tried to reach the lung to be insisted and matured. Now, also in the feces, if swallowed, we can detect it in the feces or fecal samples or specimens. Now, for ectopic infection, we can use serological method, which is more useful and applicable. Now about treatment of this infection. Here, this slide can show you the treatment for this parasite and the other parasites like intestinal flux with recommended non-drugs and antibiotic. So, the treatment began with the praziquantel drug, which is the first line therapy for all the intestinal flux and paraganglioma infection. Now, this drug, praziquantel, can cause a spastic paralysis of the worm, so it can limit its motility, and alteration and disintegration of the worm tegument, the cover, the cell membrane of the parasite can be disintegrated by the incomplementary understood mechanism. The mechanism, unfortunately, the mechanism cannot be understood yet, but we must mention and refer to. Now, for cerebral disease, a short course of corticosteroid may be given with the praziquantel to minimize the inflammatory response to dying flux. Well, now, paraganglioma may be also treated with tricalbendazole as a 10 microgram per kilogram as a single oral dose, which may be repeated twice. So this slide can end our lecture today, and we hope you will be benefited and furnished well by this information. Again, we will thanks and appreciate the references that we depend on beside our college references and beside our department in microbiology and parasitology references and library of the college. All these references be depended and followed to construct such scientific lecture, and we wish to be accepted from you all and to furnish you well. Now, any question if you have, I can answer you. Now, see you